Good evening and welcome everyone for today's webinar. Today is our 1644th day of continuous webinar. Our purpose is to unite the homeopathic doctors across the globe and share the knowledge each other. Thank you all the participants for joining with us, and thank you all the faculties for sharing your knowledge here in IFPH. And today's our guest is Dr. VIBHA MEVADA Sharma. She has already taken many rememberable classes for us. She's excellent in her presentation. And she's BHMS and CCAH, MCAH, and she's a yoga protocol instructor also. She's the student of, she trained under Dr. Rajan Shankaran, and she has done masters in advanced homeopathy, and she's author, speaker, speaker of different national and international seminars, and she awarded for many achievements, and she got many awards and appreciation letter from the State Council of Homeopathy. And today's our subject is acid and analytic group study. Dr. VIBHA MEVADA, you are welcome. Doctor, please.
Yeah. Am I audible
okay.
now?
Yes. Dr. Deepamala?
Yeah, so
okay. You made her.
Thank you so much. Okay. Thank you so much once again for giving me the platform to share my views on the topic. Can I share my screen now?
Oh, sure. You can share now.
I sent request. Please accept it.
Yeah. Excuse me, Doctor. Dr. Deepamala, can you make me as a host?
Anjani ma'am, now you are host.
Yeah. Doctor, thank you, Dr. Pankaj. Okay.
Okay, so good evening once again, everyone. So as we already know the topic for today. Okay. Screen is visible, doctor?
Yeah.
Okay.
Clear.
So we are going to discuss about the acid group of remedies today. So before going to start our session, let's remember our gurus because of whom we are here. And without wasting time, I just like to start my session here. So when we are talking about the acids, first, basically, we should know what acids are. Because in our day-to-day life, acids are all around us. Yeah? Some are corrosive, some are mild. We are using in our day-to-day life even. So when we are called acid, it's a substance that is water soluble, taste in sour, and changes the color with certain indications. Like in litmus paper, it turns red. Right? So in simple language, this is the acid. If you like to know more about the acid, so the term is origin from the Latin word acius, which means sour, yeah, which resemble the taste of the acids. And the classification of acid and base is given by a French chemist in back to 1743. Yeah? So acids are something which is we found in the nature. If we talk about the sources from where we get the acids, it's mineral kingdom and plant kingdom are the source of acids. Okay? So before going to read about the mineral kingdom sources of acid and plant kingdom sources of acid, let's see in our around in our daily use where we are using it and how much and how we are using acids. So in the industrial use, there is huge use of acids there. In the dye industry, where clothing are dry, if you know, if you put some clothes to dye with any particular selected color of your, acids are used to make that permanent color on that. Yeah, lots of medicines or allopathic medicines are prepared with the use of some edible acids. To remove sludges, HCl is used. For the fertilizer, for the explosives, acids are used. Right? And if you talk about the general, a very common use in household things, HCl use in household things, acetic acid use as a food preservative in pickles, benzoic acid and acetic acid use. To stain removal of ink, oxalic acid is used. Yeah. And if we see some non-homeopathic medical uses of acids, so some medicinal qualities is there in the acid group of substances. Like if we talk about the lemon for the sour eructation and for the heartburn, commonly in the household things, in the as a kitchen medicine we use it. Lactic acid for sour milk reduce acidity. Yeah, commonly we are having oranges, lemon, the sour fruits to eat where vitamin C is there, and that is the main thing is the citric acid is there in the sour fruits. So let's try to understand the origin of acids. Okay, so let's see about the origin of acids. So mainly, as we said, there are two kingdoms where we are getting all the acids. First one is the mineral kingdom and the vegetable kingdom. So the acids what we are found in the vegetable kingdom are all organic acids and edible acids, like in tomato, lemon, all kind of sour things, sour edible things. So that's why it's a vegetable base because it's edible. It's not harmful to us, it's not corrosive, but it have lot of qualities to help to our health. Another one is the mineral kingdom, which is inorganic acid. The acid which are corrosive in nature, which are not used for edible things, right? So this is broadly the classification of acids. So if we see a broad classification on the basis of origin of acids, there are two classification. One is organic, inorganic, I already said. So let's see some quality. So as we saw already, organic acids are vegetable based. They are generally weak acids. That's why it's edible. Generally insoluble in water. The biologically they are origin. Yeah, on plants we are getting that fruits which contain this acid, which is slow and progressive in action. Right? Other than that, if we see the inorganic acids, which are corrosive in nature, which have tendency to create a deep pathology, which are very rapid in action, very acute in reaction. As soon as you come in contact with them, it reacted, which are highly corrosive, which are insoluble in organic solvents, but soluble in water. And they are strong acids. So, what is the thing there in the acids which differentiate or which makes some acids are very safe to eat and some are very dangerous, even we can't touch them? So what is the thing there which makes this difference in all different kinds of acids, and or we can say in different kingdom, in both the kingdoms of acid? So when we are talking about the acids, we are talking about the hydrogen, because all acids are producing hydrogen ion when they dissolve in water. So in how much quantity the hydrogen ions an acid can produce, that determines either that acid is safe to eat or not, how much it's alkaline or how much is acidic. So this hydrogen ions is the thing which differentiate the safe and unsafe acids, we can say. So how can we come to know? How can we measure it? So for that, back to 1909, a scientist who develops a method where we can quantify the acidity of substance, where you can measure the acidity of the substance. And right now, that method is called the pH scale. From that, we can measure the acidity of the substance. And this is the pH scale. So this pH scale decides what is safe, what is unsafe, what is acidic, what is alkaline. Yeah. So as you see this graph, as it comes toward the red, it's acidic. As it goes toward the blue, it's alkaline. Yeah. So we can see here the battery acid is very corrosive in nature. The stomach acid, yeah, HCl, what we can say, it's corrosive in nature because it digests all our food and all. Then the wine, which is acidic in nature, but it's not that much lethal that if you come in direct contact and immediately it reacts. If we talk about the water, if you see here, it's on a mark 7. And it's safe to have, right? So like that, this is the measurement scale for the acids. Now I feel we have a basic idea about the acids, about the sources of acids. So let's come to understand now the homeopathic perspective and how we can link or how we can understand this source and the patient's language and the patient's quality, where we can find out that the particular patient is belonging from this group. So let's see the qualities patients present if they are belonging to acid group. So the very first and the very important symptom to land on an acid group, that is the weakness on 4 mark, a profound weakness. Yeah. And the mineral acids produces an irritability of fibers together with the weakness and prostration. There is lot of irritation with the weakness and prostration. Whereas if we talk about the vegetable acids, there is weakness but without irritation. So we can differentiate here in the group itself. In the acid group itself, we can differentiate either the patient is belonging from the vegetable acid or from the mineral acid. Along with weakness, there is peculiar debility is there. And this debility is not like the functional weakness like we can find out in the syncona, like weakness after exhaustion, weakness after diarrhea, after blood donation, after uh, you know uh, if there is electrolyte imbalance, then weakness is there. This all are the weakness of syncona, China. So acids weakness is not that much simple. Or we can find out the nervous weakness of zinc. But acid weakness is not either the functional, not the nervous related, but it's more than that. It's related to the defective nutrition and the debility because of the blood diseases. It's more severe. It's toward more severe. Yeah, when the exhaustion is from the abuse of various organs of the body, so many things are disturbed together, and then the exhaustion is there. And because of that, if you know a gross idea for the drunkards, the sulfuric acid, phosphoric acid, arsenic acid are the good remedies for them, because out of a long use of excessive liquors, there is so many things, so many organs are exhausted already in the body. At that time and at this situation, we can use acids there. Another peculiar quality is hemorrhagic tendency. Hemorrhage from any orifice of the body. Yeah? Acids have ability to develop the hemorrhages as well as to check the hemorrhages. Yeah, physically, if you come in the contact of the corrosive acids, they can develop in an acute reaction, they can develop the hemorrhages, as well as in the potentized form, that corrosive acid can check the hemorrhage in a very fast manner. Another very important quality or symptom you can say of acid is the burning sensation, and it's not like a normal burning sensation. It actually make feel the fire in the body or in the particular part, and this burning sensation is because of the irritation of nerves, which is unbearable kind of burning. You know, all the symptoms, if you point out till now, there is no any a very minimum or a medium symptom of anything. The symptoms, any symptom, all the symptoms are on a severity always, because acid can cause a destruction. So we can found the symptoms also on that level. See the destruction, septicemia, ulceration. This type of pathologies are there. And on this type of pathologies, acid works like anything. Let's see the keywords. These keywords, when we are talking about the qualities and keywords, it means these are the things we can get in our patient to understand the group or to understand the patient, that the patient is belonging from this group. So the keynote, if we find out of acid group, that is the activity and hurriedness. They are not the one who can silently, patiently sit and listen to you. As their pathology reacts, as the source is very corrosive, very fast to react, the mind of the patient is also like that. They want everything in hurry. They are in hurry. Patience-less person. No? And their energy level is very high. They have a lot of energy in themselves. And that's why the overactive people, and and they are not complaining on small things. They complain always when the disease is come on a higher level or on a end level. Then they start complaining, oh, this thing happening. And they are the extrovert people. They can easily talk to anyone. They are not like who can silently sit on a corner. As well, you can compare their aggression to the source also. Yeah. So they can't accept things which are not going according to them. Against their will, they can't accept anything. They can't let go the things. They're stuck with the things. Yeah. And this aggression side expresses by the physical symptoms also. By the symptom of itching complaint, apathy, ulcers, fixtures. Behind this aggression and everything, they have another desire to be unification. Means they want everyone to be united, to be together. Everything and everyone become one. And if you have little bit idea about the hydrogen group of remedies, which is the responsible for our source indication, hydrogen have this quality of unification on a very high level, more than these acid groups. Right? Now let's see the mind. Yeah? Exhaustion is the most common and well-known character of acids. Because the energy is high, they are extrovert people. They can't stay at one place. They will always doing something. They got exhausted. And when they exhausted, it's like we can't move now because they are exhausted. It's not like they are feeling weakness and they are so they can move. No, their exhaustion is like they can't move their finger even now. That much exhaustion is there now. Stand still, they stay on the bed. As we see, the destruction is there in the pathology. We can find out this in the mind also, as the mind, as the emotion, as the pathology. Everywhere you will find the synergy when a particular patient is belonging to the particular group. So here is the destruction of thinking power. They are not so logical, they can't think much. There is a lack of memory is there, lack of concentration is there. And out of all this thing, they are oversensitive now. They got very irritable. They are doing the destructive activities. They are vindictive become. They become the hateful people. Yeah. And self egotism is also there. And out of all this situation, at the end, they land on depression, dejections. And another main quality of there is the dictatorialship. They are the one they who doesn't want to work under control of anyone. And as their energy is high, their metabolic rate is high, the destruction of things are high, they looks old in young age. And acids contain both homicidal and suicidal tendency. This represent the corrosiveness of mind. They can harm himself also, they can harm others also. Right? So isolation is also there, apathy is also there. Right? So here the comparison again from the hydrogen is given. The hydrogen also has the opposite feeling, a deep feeling of isolation, of being separate from your fellow being and loved ones. As they want everyone together, the exactly opposite feeling is also there, to be isolated. So hydrogen have both the feeling of total unification and the sensation of a total isolation as well. And why we are talking about the hydrogen here? As we see, hydrogen ions decides about the acids which is safe, and you know when they dissolve with the water, they develop the hydrogen ion there, and that's why these qualities are there in the patients also. So if we see the doctrine of signature, the similarity of the source and the symptom, most of the acids are colorless, and acids are work well in the anemia where the paleness is there. Yeah, most of the acids are odorless, but some have the peculiar odors also. Similarly, we can find out some peculiar odor of the urine of acids. Yeah, all the acids are corrosive in nature. Most of the mineral acids are corrosive in nature. We can find out that discharges are corrosive, which can make burning, like nasal discharge, eye watering is there, leukorrhea is there, diarrhea is there, burning after diarrhea. Yeah. So course, till now we understood the diathesis is hemorrhagic diathesis. And in hemorrhagic diathesis also, in mineral acids, the active bleeding is there, and in organic acids, the passive bleeding is there. So if we talk about the miasmatic background of acid group of remedies, till now, what are the qualities, keywords we saw? We understood very clearly the syphilitic miasm is there. The predominant miasm of acids are syphilitic. And what are the qualities of syphilitic miasm? The destructiveness, suicidal, violence, hopeless, finish, homicidal. All this thing we found in the group. So if we talk about the sphere of action, so it works well on mucous membrane, on glandular system, on skin, blood, digestive organs, on bones. And if we talk about the constitution, how they looks, as their metabolism is very fast, very high, they exhaust easily, we can found a stoop shoulder people, like you can see in the picture, who looks prematurely old, and a lean thin people. They eat well, but their appearance is lean thin always. If we talk about the characteristics, definitely the discharges, which are corrosive in nature, hemorrhagic in nature, because the acrid discharges are there, acrid leukorrhea is there, itching is there after that, severe burning, and pain is also of burning and cutting type of pain is there. If you are talking about the modalities, so if you talk about the miasmatic understanding here, for the generals, for the aggravation time, the syphilitic miasms have a night aggravation. So here in acids, nighttime aggravation is there, amelioration by motion, rest, lying down. The desire for the fat, alcohol, fruits, or the sour things they desire, and averse from bread and coffee. So here, just telling you a easy way to remember all thermals of all the acid remedies. That is, all the acids are chilly, and all the acids are sensitive to cold draft, except fluoric acid. Right? Other than fluoric acid, all are chilly. Yeah. So let's see the physiological and medicinal effect of acids. So antidote for intoxication. Acids can antidote toxins, antidote and complementary action of certain drugs. So let's see the mineral acids. If we talk about our remedies, so this all are the mineral acids, and these are the organic acids with their source it's given there. Yeah. So as we see, acids can antidote the actions. So acetic acid antidote the anesthetic action. The causes poisoning. Muriatic acid is it's a powerful antidote to mercury and opium. Nitric acid is for mercury. Sulfuric acid is for the lead poisoning. So acid group of remedies have a huge importance in therapeutics. So when The condition is of a hemorrhagic. Acetic acid is for the hemorrhage from ball or when the metrorrhagia is there. Arsenic acid is there again for the metrorrhagia. Violent bleeding from the nose, swelling and bleeding of the gums. For epistaxis, benzoic acid is there. For bloody stool, the carbolic acid is there. For hemorrhoids, which are bleeding in nature, chromic acid is there. Yeah. So now in acid group, phosphoric acid is the medicine which have a theme also to understand, because most of the acid group of remedies have a huge importance in therapeutics. Yeah, so we will see some of the medicine as time permit. We will see most of the medicines here, and going to start with the phosphoric acid because it's a well proved with their mind symptoms and everything. Right? That's why elaboratingly explaining the phosphoric acid, and we'll see the highlight or therapeutic symptoms of other few more medicines of acid. Yeah. So when we see the common use of phosphoric acid, so in the dental cement, the phosphoric acid is used. In the sugar and textile industries, also the phosphoric acid is used. Yeah. Also used to make phosphate salts for the fertilizers. If you understand the patient point of view now to the phosphoric acid, the very main and the core feeling of phosphoric acid is I must constantly care for others in order to be loved or accepted. If you try to resemble this line, you can remember the phosphorus remedy also there, who also want the love and care and affection, and out of that, they are behaving the same with the others. Yeah. So here in phosphoric acid, we will definitely found the qualities of phosphorus along with the acid qualities. Yeah. So that care and all this thing will be there here also to get love because they longing for the love. And that's why they are behaving the same way what they longing for. And if we see the acid part here, the acid qualities here, the element from loss of vital fluid, element from sexual excess, element from the violent acute diseases. The acute disease is there, but violently. The mental emotions which are there from the long time, like disappointed love. Yeah. And if we see, ignatia is the complementary to phosphoric acid. Yeah. So what ignatia we saw here is when a young oversensitive woman finds that time and again her hopes have been believed, she may finally get into a state where there is no use of trying. Yeah. So like ignatia is also like that, the young sensitive woman. But in phosphoric acid, it's like she need to become insensitive now. Now she tried, and now the end point is there. where she become insensitive and apathetic. Because the feeling is there that now at this point there is no use of her emotions, no use of her sensitivity, no not care for her sensitivity. There is no use of her hysteria, which is there in the ignitia. So this develops the indifference behavior in the state of phosphoric acid, right? So let's see the another remedy here, acetic acid. So common uses of acetic acid, we can see it used as an antiseptic due to its antibacterial quality. We use acetic acid in pickles also. Uh, we use as a common vinegar. We are using it in some cooking also, in some food item, especially in the Chinese food. We are using it. It's used in manufacturing of various perfumes. Yeah, and medically, it's accepted to employ the treatment for cancer for by direct injecting it on the tumor. And therapeutically, if we see the homeopathic use, there is great prostration, no doubt. In all the acids, great prostration is there. But here in acetic acid, after injury, after anesthesia, or after surgery, the great prostration is there. You know, surgical shock is there so many times. Acetic acid is the remedy. The burning thirst is there. Large quantity of water they need. But there is no thirst in fever. Yeah, thirstless fever is there. As the hemorrhagic tendency is there, from every mucous outlet, the hemorrhages are there from nose, throat, stomach, bowel, uterus, lungs, from everywhere. So acetic acids are chilly patient. They are flabby muscular people. And the slipping position is very marked in acetic acid. They can't lie on back and they feel very much better on lying on belly. Huh? There, as we saw already, the bad effect of surgical shock and all. When the insect bite there, when sauces poisoning is there also, acetic acid can use. After copious exhaustion, if diarrhea is there with a great thirst, can use the medicine. Let's see the arsenic acidum. And if we are talking about the source, it's a highly toxic and multiple use of it. Yeah, so it's used as a wood preservative for non-food application. Mhm. So in non-crop area, the arsenic acid can used. And as we know, there is no arsenic without mental restlessness. So alike the mental restlessness with physical weakness, because here arsenic is with the acid, so mental restlessness is there with physical weakness. And the similar symptom as it's there in the arsenic also, arsenic album. The burning pain relieved by heat except head. The fear of death. The complaints are periodical. And discharges are offensive, acrid, cadaverous smelling. A very bad kind of smell. Sadan wali smell. The thirst is also very particular. A small quantity of water at shorter interval of time, like 2 sip of water in every 15 minutes or 30 minutes. In acute condition, but in chronic situation, there is no thirst. Thirstlessness is there. From a very small exertion, a lot of exhaustion is there. And as nighttime aggravation is there, so in arsenic acid, midnight and after midnight the aggravation is there. Midday or midnight aggravation is there. Patient is chilly, and of course, if arsenic is there, fastidiousness is there also. Let's see the benzoic acid. So for the dyeing and making perfumes, benzoic acid is widely used in the industries. And commonly it's used as a pH adjuster to preserve the food, to preserve the growth of microbes in the food, like in sauces, like in pickles, benzoic acid is used. We talk about the complaints, the rheumatic and gouty complaints are there where we can think of it. And a very peculiar kind of urine is there, which is very dark brown is color, and the smell of urine is highly intensified. Even in the first or second room after the washroom, you can get the smell of urination. That much a strong odor of urination is there. Nocturnal enuresis is there in the delicate children's, the nighttime bedwetting, which is again characteristic of a strong odor of urine. And with the nighttime bleeding of nighttime urine of children, exhausting diarrhea of children is also there. This medicines can cover that also. The stool is white in color, liquid, very thin stool is there, very offensive. And the medicine is of a left-sided complaint and it's chilly. Another one is the boricum acidum. If you see the general uses, it used as antiseptic for minor burns and cuts. Yeah, for the vaginal wash also, it's used to treat the bacterial vaginosis because it's excessive alkalinity of the vagina, as well as in the condition of candidiasis also. And it's used in the eye wash also. Yeah. If clinical condition we see the climacteric flushing in the woman, especially when before the menopause kind of symptom, like flushing is there at the climacteric age. Another one is the renal colic with frequent urging to urinate. The formication of hands and feet is there, like something is crawling on this hand and feet. This sensation is there. And headache with noises in hearing and vertigo. The tinnitus complaint. Another one is the carbolic acid, widely used again as an antiseptic, apart from being used in many commercially available products also. So carbolic acid is a phenol used for the cleaning purpose, for the antiseptic purpose, to clean floor and bases. Yeah. Other than that, some cosmetic use of carbolic acid is also there, which is there in the cosmetic products like sunscreen, hair color, skin lightening preparations, and as well as in the skin toners also. If we talk about the homeopathic use, the main symptom is pain comes suddenly, last for a short period of time, and disappear also suddenly. Yeah, the whole of the body is bathed in a cold sweat with prostration of all collapse. Cold sweating is there, and then the prostration is there, and the patient collapse completely. Yeah, the frontal headache is there, where the sensation is of a bend around the forehead, and there is a great desire for whiskey and tobacco in the carbolic acid. There is constipation with horrifying offensive breathing is there. Yeah, vomiting of drunkards or in pregnancy. The seasickness is there, or the vomiting of even a cancerous condition. You can think of the medicine. And carbolic acid generally aggravated from cold. Let's see the floricum acidum. Going a little bit faster at time running. So the common uses are mainly in the industrial purpose. Yeah. It's mainly a male remedy, and the destructiveness is the key for the remedy. Definitely, the miasm is syphilitic. Again, it produces slow and deep destruction. The decayed kind of condition it develops. The ulcers, bed sores, varicose vein, and discharges are acrid, prematurely old look of the patient. Yeah, they crave for the cold water. And the best suited this remedy is for the chronic diseases with syphilitic and mercurial history. Let's see the hydrochloricum acidum. It's a chemical weapon agent because it's a deadly poison. Yeah, so in older times, it's used for in the weapons. In the arrow. Yeah, so it's a colorless gas, liquid with a strong pungent odor that causes irritation of eyes and respiratory tract, as well as toxic to the system. And the medicinal use, if we see, the convulsions and paralysis express the actions of this remedy. The suddenness of the attack and prostration are leading indication for the medicine, and the sinking sensation at the epigastrium. Another very important symptom for this remedy is the fear of everything. There is unnecessary fear of everything is there, because it's imaginary trouble is there. Nothing there physically, nothing, no problem is there physically, but the problem is there in the mind, right? Let's see the nitric acid now.
We
Main
have
use,
Dr.
yeah, we
Vibha,
have, yeah,
only
yeah, yeah,
3 minutes more. So I
yeah,
think
yeah,
we'll
I'm
wind up.
binding. Yeah, I'm binding here only. After this nitric acid, I'm just binding. So nitric acid commonly used in the print making, right? If it is see about the medical use, the urine is very pungent here also. A very strong smelling horse kind of horse like smelling urine is there, which is the main indication of the remedy, right? And the last one is, I think, the oxalic acid. The oxalic acid is widely used in acid rains in laundries, especially for moving rust and all. It it's very corrosive in action. The characteristic is pain, sharp, lancerating pain is there. Okay, and there are three key notes to understand the oxalic acid. First one is it's a left-sided remedy. Second one is the stench peculiarity that needs mention is that out of whole of the left region, it makes a natural selection of the lower lobe of the left lobe. So that is the very key point of there. And the third one is the aggravation of all the symptoms merely through the diseases. To think of disease also make them sick, right? So I think I should end up the presentation here now. Thank you so much for the patience listening, everyone. And yeah, so over to you, doctor.
Thank you so much, Dr. Vibha. As usual, you have taken the classes very cool manner. You are not coming under acid group of medicines. You're very
Of course not.
you're very cool
Yeah,
and very patient, patient nature. Anyway,
yeah.
I think there is no time to question and answer. We have only
Okay.
1 minute remaining. Anyway, thank you
Okay,
so
so
much.
my number is there in the screen. If anyone have any question, they can message me. No problem.
Yeah, even in the chat box also you can type your questions in the chat box. Doctor will answer to your questions.
Yeah,
Now it
in the
is,
chat box only.
yeah, and you can write down her number also. It's here. It's here in the screen. It is visible here. If you want to take, you can take. Dr. Ram Parvesh was raising hand, but unfortunately we don't have time, sir. I'm so sorry. Now we are moving to Malayalam session. Dr. Manoj, who is moderating Malayalam session?
Dr. Mariam Majan.